to Endocrine Wellness. My name is Dr. K, and today we're going to talk about insulin resistance. The purpose of this video is for educational content only, and please discuss with your doctor for your specific treatment plan. Just high circulating insulin levels alone is associated with a lot of other chronic inflammatory conditions. The insulin appears to stimulate a lot of unwanted tissues in your body, and as a result, they promote the growth of tumors and cancers. They also promote the growth of skin tags and skin folds. We see patients with skin tags in their neck, or they have acanthosis nigricans, just basically a velvety darkening of the skin in the back of their neck, underarms, under their breast, in the groin area. Those are all markers of insulin resistance, and insulin usually makes these tissues grow, working as a growth hormone on these tissues. In addition, this insulin resistance continues to get worse and the blood sugars start rising, then the patient progresses on to becoming pre-diabetic and diabetic. And we all know that diabetes comes with its own set of complications, including eye damage, blindness, kidney damage, needing dialysis, neuropathy, causing stroke, heart attacks. Glucose and insulin combination together also causes a lot of inflammatory issues and inflammatory states to get worse, including like arthritis, heart conditions, stroke. We see a lot of polycystic ovarian syndrome, PCOS in females, and low testosterone in men, just associated with insulin resistance and weight gain. And these younger middle-aged patients, when they lose weight and get onto a healthy lifestyle and healthy eating habits, we actually see that their testosterone levels improves in men, and in females with PCOS, their periods get more regular, they're able to get pregnant if they previously had infertility. We're going to talk about the spectrum of insulin resistance and how we can measure this. So when insulin resistance at the very initial stages just starts with very mild insulin resistance, where a little bit more insulin is needed to push the glucose into the cells from the bloodstream. As this person continues to gain weight or stay less active or eat high carb diet, that insulin resistance gets worse. So the pancreas is having to produce a lot of insulin to push the glucose into the cells. Now we're entering the phase of what we call as hyperinsulinemia, which is part of the insulin resistance spectrum. So in patients with hyperinsulinemia, their glucose levels, when you measure like A1C or blood glucose, is still pretty normal, but the amount of insulin they had to produce compared to another person as age and sex matched is usually much more. For example, if your fasting insulin level is supposed to be like 3, and when this person becomes insulin resistant, their fasting insulin level is already 30, and their blood glucose stays the same. Let's say their blood glucose was 85 before they became insulin resistant, and now it's still 85, but the amount of insulin needed is 10 times more. We call this hyperinsulinemia. That's, maybe the initial stage of insulin resistance. Then the insulin resistance continues to get worse. Now they enter into the stage of prediabetes or impaired fasting glucose or impaired glucose tolerance, where their glucose is not high enough to be in the diabetic range, but their insulin resistance is significantly worse, that even though they're producing massive amounts of insulin, their glucose stays in the bloodstream a little bit longer than usual. Eventually they do enter their cells and the blood glucose comes down, but the time is a little bit longer than usual, so they start showing up on the blood work as pre-diabetes or fasting glucose slightly elevated, usually between 100 and 124, or their post-meal blood sugars a little bit elevated, not super high to qualify for diabetes. But the problem is this patient is already severely insulin resistant before they're entering the pre-diabetic phase. Now this patient continues to become more and more insulin resistant, not changing their lifestyle or habits, then they progress on to becoming diabetic, where now their pancreas is producing a lot of insulin, but that's not enough to overcome the insulin resistance. So the blood glucose stays in the blood vessels for a long time instead of entering the cell, so the glucose stays high, causing diabetes and its own complications. So we look at the spectrum, starts with a little bit of insulin resistance, there's hyperinsulinemia where there's significant insulin production, moves on to pre-diabetes, and then moves on to diabetes. Now a lot of my diabetic patients ask me this, that I'm already a diabetic, am I still insulin resistant? Absolutely, because you are in the diabetic phase after going through subsequent stages of insulin resistance. Can we reverse this? Absolutely, most type 2 diabetics can get to a lower insulin state with lifestyle changes, with diet, with exercise, with losing body fat. Can they go all the way back to normal? Well, that depends on the patient and how long they've had the insulin resistance. But our goal is always to go to a lower insulin resistant state and possibly to not be insulin resistant at all. And that's it today. If you find this information useful or you think a friend or family could benefit from this information, please share the video. Please like and subscribe to the channel. If you have any more questions on this topic, please email the channel and I will try to answer them as soon as possible. Thank you for being here.